Dear audience, every operation indeed has its own risks. Of course, there are risks involved. It is necessary to state and accept this from the beginning. Both your doctor and you need to accept this. When discussing tummy tucks, it is important to note that there are risks related to the surgery itself. Also, there are risks linked to anesthesia. Of course, the risks associated with anesthesia must be handled by a surgeon you trust in a reputable hospital. A trusted anesthetist will perform the procedures and treatments that minimize these risks both before and after the surgery, in any case with due diligence. If we talk about surgical risks, we have already mentioned the placement of a drain in the operation site. This is necessary to drain fluids like blood and serum that may accumulate inside. Sometimes these drains might not work properly, causing hematoma or blood to accumulate inside. There may be instances of fluid accumulation inside, such as seroma or blood buildup. If the amount of hematoma is very small, simply waiting may be sufficient for the body to absorb and dissolve it. Seroma frequently occurs. The process of removing the serum-like fluid that builds up inside will primarily serve a therapeutic purpose, and it won't happen again, and it will not bring you any additional aesthetic or health-related issues. Apart from this, there is always a risk of infection in every surgery. So far, I have not faced this issue with my patients. However, if it does happen, I would like you to understand that these can be easily managed with suitable antibiotic therapies. Besides this, issues regarding wound healing may arise during a tummy tuck procedure. Here, the patient's additional health problems such as diabetes are more pronounced in uncontrolled diabetes, where the risk of wound healing is somewhat higher. Being a very careful and selective doctor if diabetes is not managed properly prior to surgery. I request that an endocrinologist check the diabetes regulation before surgery. I hesitate to operate on patients who don't meet this condition. I won't perform the surgery. If diabetes is under control, whether it be through medication or insulin treatment, if diabetes is under control, the risk of surgery is not greater than that of non-diabetic patients. Smoking is another significant factor that can complicate wound healing during abdominoplasty. If feasible, quit smoking at least 1 month prior to the surgery. If quitting is not possible 2 weeks before surgery, reducing smoking significantly will greatly benefit us. Besides this, wound healing is also affected by how aggressive we as surgeons are. It means doing a lot of liposuction during the tummy tuck surgery. Therefore, while performing liposuction during a tummy tuck, we must carefully set our limits and know when to stop. We should be able to stop. After this, we can mention potential risks in tummy tuck surgery, such as scarring. Typically, when we perform an incision on patients, the area appears a bit redder under the stitches for the first couple of months. The redness will start to fade after 2 to 3 months. Generally, in 6 to 9 months, the redness will match the skin color and become subtle. Here is a depiction of the normal healing process for wounds. But in some cases, it can happen unexpectedly in certain patients. We refer to the exaggerated continuation of wound healing as hypertrophic scarring, which is a step above normal wound healing. The more advanced stage, commonly known as keloid, is characterized by exaggerated wound healing patterns that you may encounter. We may encounter this. How it appears externally to you can be described as swelling, redness, and the persistence of swelling, which continues to increase. This occurs in less than 1% of cases. Unfortunately, it is not possible to predict in which patient it will occur. This is a condition arising from the patient's wound healing capacity, independent of the surgeon or the materials used by the surgeon. Here, we can assess whether a patient may have keloid or hypertrophic scar. If they have had surgery before, we would like to examine the scar left by it. If a patient tends to develop keloid or hypertrophic scars, previous surgeries probably displayed this tendency. We believe that challenges have arisen. Before the operation, it is essential to talk with the patient about both the information and the measures that can be understood, and to make a decision accordingly. The key step to follow a path is crucial. The basic risks associated with the tummy tuck surgery I referred to were these. When we step back and view the situation holistically, I cannot say that the risks are overly exaggerated or excessive. I cannot say that.